Hello, everyone. My name is Bhatija Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
Hi, hello everyone. I am Dr. Dhivay Bhatija. I am a practicing cardiometabolic physician, diabetologist and intensivist. I have been practicing in chamber since last almost more than 10 years now.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Hypertension leads to weakness or loss of elasticity of your vessels, which is known as atherosclerosis, which can lead to major side effects like heart attack, paralysis, strokes. So even though if you are feeling better, then you also need to keep your BP under strict control by taking regular medicines, following a good lifestyle practices.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
It is known as silent killer because, as I said, it leads to hardening of the vessels of your heart, specifically brain and heart, which are the two major organs being involved with it. So if the vessels get hard enough, the flow of the blood reduces, which leads to major side effects like coronary artery diseases, strokes, paralysis, renal failures.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Over here, I would like to say both of them play an important role. Lifestyle plays a major role, like class A personality patients who are very busy with their work. They don't get time for a proper workout or exercise. So they just depend on medicines. I would suggest that changing your lifestyle should be a better option rather than directly going on to medicines. And genetics also play an important role over here.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
The blood pressures is defined into systolic and diastolic, which is the upper one and the lower one. For the normal range, we take it systolic ranging between 110 to 130 millimeters of mercury, and for the lower one, the diastolic, we take it between 80 to 85 millimeters of mercury. Anything crossing more than 130 by 90 millimeters of mercury is called as hypertension.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
For the newly diagnosed hypertensive patient, I would advise them to first try to change their routine, include a good DASH diet, include a good amount of physical activity like roundabout. If we calculate in a week, it can be around 130 to 150 minutes a week, and changing in the salt, reducing the amount of the salt intake per day. So lifestyle changes are important over here.
Can we say that hypertension can be treated without medication?
Hypertension, if it's being diagnosed early, yes, it can be treated by medications. For that, you require a lot of dedication by the patient to follow a good lifestyle, follow a proper diet, reduce the amount of salt, increase the physical activity, and keep a regular check on his numbers. With these lifestyle changes, if the numbers are well maintained, so I don't think they require medicines.
Okay, doctor, you just talked about medication right now. So I would like to know what are the most common side effects that people should look out for while taking medications for hypertension.
The blood pressure medicines are divided into multiple groups. It also depends what medicines are they on. If they are on something like diuretics, then we need to keep a check on their renal function test. We need to keep a check on their electrolytes level. If they are on something like ARBs or ACE inhibitors, we need to we need to check the potassium levels. We need to keep a strict watch on their coughing.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
Now I feel this is a misnomer because Lifestyle changes play an important role. If a person on medications is following a good lifestyle changes and he is trying to maintain his numbers well under control, so there are chances that the patients might come off the medicines and they can just keep a watch by following a good lifestyle.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
It should be checked approximately 1 to 2 times a day if they are newly diagnosed, and then we can gradually just make it to once or twice a week if they are well under control with the lifestyle changes and also their medications.
I would also like to know what would happen if high blood pressure gets untreated for years and what parts of the body gets affected the most?
As we had said previously, that hypertension is a silent killer if it's left untreated. So the major organs that get involved are the heart, the brain, the kidneys, the eyes. So we have to be very careful to avoid strokes, heart attacks, retinopathies and nephropathies.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe and share your valuable insights with us. Always remember, stay informed, stay proactive and most importantly, stay healthy. This is Bhatija signing off from this podcast, Win Over Hypertension.